Hello, my name's Shioni. I'm one of the registered nurses of the Day Procedure Unit at Redcliffe Hospital. Some of you may have heard this information before, either at pre-admission clinic or from a phone call. This information is very important, so it doesn't hurt to repeat it. To maintain your safety and avoid complications, it is essential that you don't have anything to eat or drink after the time you have been told. Generally, procedure is scheduled for the morning. You must have nothing to eat or drink after midnight the night before. If your procedure is scheduled for the afternoon, you must have nothing to eat or drink after 6 in the morning. If you need to take medication or are very thirsty, you may have a small cup of clear fluids up to 2 hours before your procedure. Remember, clear fluids includes water, clear apple juice, or black tea or coffee. That means no milk. If in doubt, stick with water. It is also essential to not have any chewing gum, mints, or lozenges. If you're an insulin-dependent diabetic, you should receive more specific instructions. Your procedure may be delayed or even cancelled if you have not fasted for long enough, as it would be unsafe to proceed. If you are not sure when to fast from or any other aspect of your preparation, please phone the hospital to check. A few things to remember to bring: your Medicare card and any other pension cards, your x-rays or scans if you have any, a list of your regular medications, a small bag to put your clothes in, and something to do to pass the time, for example a book or some music with headphones. A few things to remember not to bring: valuables such as cash or jewellery, prescription pain relief medication, too many friends or family. Remembering the things we've talked about in this video will help things run as smoothly as possible on the day, and that's good for everyone. This part of the video will take you on a virtual tour of the hospital and Day Procedure Unit. The first thing you need to do is check in at patient registration. You'll be asked to provide your Medicare and any other pension cards you have. The staff there will check all your details. They will give you a red admission sheet to bring to the Day Procedure Unit. Once registered, a volunteer will usher you to the Day Procedure Unit, show you where to sit, and let the staff know you have arrived. Please remember, the patients could be scheduled for any of the 6 operating theatres or 2 procedure rooms. This means that someone who arrives after you may be called in before you, simply because they are having a different procedure. You'll be called in to be admitted by the nurse in order of the procedure list. The nurse will take you to an area where you'll have your temperature, pulse, and blood pressure checked and measure your height and weight. A vital part of your preparation is patient identification, where the nurse will check your name and date of birth. You'll have an identification bracelet put on your arm or leg. Your armband will have a red border if there are any special alerts we need to be aware of. To keep the theatres as clean as possible, you will have to take all your own clothes off and get changed into special theatre clothes, including underwear. The cotton gown does up at the back, and we will give you a toweling dressing to wear over the top to maintain your privacy. You will see the staff either washing their hands or using hand gel. This is to keep everything as clean as possible. Some procedures require extra preparation, such as urine testing, hair clipping in the procedural area, and application of surgical stockings to prevent blood clot. The nurse will inspect your skin for cuts, rashes, or pressure injuries. It is very important to tell the staff if you have any of these so they can provide the most appropriate care. You'll be asked lots of questions, as the nurse will go through a checklist to prepare you for your procedure. You'll be asked these same questions 2 more times before you go for your procedure. This is to triple check that your procedure is safe to go ahead. Once you are fully prepared, you will be returned to the waiting room or to a trolley where you will wait until theatre is ready for you. There are toilets close by, and the waiting room has a TV, reading material, and puzzle books to help pass the time. In some cases, the wait can be very long because emergency cases take priority and can cause delays. We are sorry that this happens, and will keep you as informed and comfortable as possible while you wait. As soon as possible, you will be called for your procedure. Most people walk to the area, but some go on trolleys. When you reach the procedure area, the nurse will involve you in a handover of you and your clinical information. You are encouraged to participate in this process and ask any questions you wish to. Your feedback is important to us, so we can provide the best service possible. We welcome your suggestions either in person or on the Help Us Improve forms found in the waiting rooms. It's really important that you are patient, talk to us, and tell us how you're feeling. The The staff in the day procedure unit are there for you and will help make you as calm and comfortable as possible. One of the most important things to remember is to organise an adult to care for you after your procedure. This carer will need to stay with you for 24 hours after your procedure, as you'll still be under the anaesthetic drugs. It's essential that this person can pick you up from the hospital. They can park at the front of the hospital, leave their car there, come up to the day procedure unit and listen to your post-care instructions. Thank you for taking your time to watch this video. We hope that it has helped you feel more prepared for your procedure, and we look forward to caring for you soon.